CEN Test Prep Exam Khan Academy. Question 1. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects: Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 2. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates: Option A, normal cellular metabolism. Option B, hypoperfusion and anaerobic metabolism. Option C, kidney failure. Option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 3. The most common cause of lower gastrointestinal bleeding in adults is: Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A hyphema involves: Option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 5. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 6. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, a complete blood count. The correct answer is option C, CT scan of the abdomen. Question 7. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 8. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A, a damage above the midbrain. Option B, a damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates: Option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. Question 10. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, the EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 11. Meningitis is an inflammation of the option A, a brain parenchyma, option B, meninges covering the brain and spinal cord, option C, peripheral nerves, option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 12. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval, option B, peak T waves, option C, ST depression, option D, delta waves. The correct answer is option B, peak T waves. Question 13. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts, option B, pregnancy status, option C, endometriosis, option D, PID. The correct answer is option B, pregnancy status. Question 14. In distributive shock, the primary pathophysiology is option A, pump failure, option B, widespread vasodilation and increased capillary permeability, option C, fluid volume loss, option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 15. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction, option B, arm held in external rotation and slight abduction, option C, patient unable to flex the elbow, option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. Question 16. A patient with a Le Fort 3 fracture is at highest risk for option A, dental malocclusion, option B, airway compromise, option C, corneal abrasion, option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 17. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from option A, peptic ulcer, option B, esophageal varices, option C, hemorrhoids, option D, Mallory-Weiss-Tear. The correct answer is option B, esophageal varices. Question 18. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances, option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation, option C, a hospital policy allowing nurses to refuse any assignment, option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A, a scalp laceration, option B, an orbital wall blowout fracture, option C, a nasal fracture, option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 20. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be option A, elevated PaCO2, option B, low PaO2, hypoxic drive, option C, increased pH, option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Question 21. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Question 22. The antidote for benzodiazepine overdose is option A naloxone, option B flumazenol, option C N-acetylcysteine, option D atropine. The correct answer is option B, flumazenol. Question 23. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A administer pain medication, option B perform a complete neurological assessment, option C prepare for lumbar puncture, option D obtain a non-contrast CT scan of the head. The correct answer is option D. Obtain a non-contrast CT scan of the head. Question 24. The purpose of administering surfactant to a patient with ARDS is to option A bronchodilate the airways, option B reduce alveolar surface tension and prevent atelectasis, option C decrease pulmonary capillary permeability, option D increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Question 25. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A atrial flutter, option B prolonged QT interval, option C Osborne, J wave, option D ST depression. The correct answer is option C, Osborne, J wave.